Let's just spend a few minutes here talking about a case that I did recently. She's 60 years old, and it's not a cookie cutter straightforward case necessarily because she did have prior trauma here. So she has a large scar on her face that gave me pause, and I need to really critically think about the surgery because scars like this interrupt blood supply, and plastic surgery and beautiful healing is all about respecting the blood supply, whether it's reconstructive or cosmetic. So next slide here is going to show you the area of undermining that is involved with a deep plane facelift. As you know, I always mark that line from the lateral canthus to the angle of the mandible, and that's the limit of the subcutaneous undermining of the tissue. And she had a scar that was kind of in the area, so it gave me pause, but I realized that we have an anteriorly based flap, meaning the blood supply to the remaining tissue is going to come from the anterior area, and it's relatively unaffected. So next slide. We were able to analyze her tissues. She's got some cervical mental laxity, marionette lines, nasolabial folds. So after the surgery, here's her picture. She's beautiful. I took out the submandibular glands, digastric muscles, etc. She's doing great. And then at 6 weeks, she's healed up really, really well, but she still has the scar. And on the other picture here from the front view, you can see that she still has pigmentary issues. Let's look at the cross section of the human skin. And you can see here that the ultra clear laser that I like and that I use, and probably all lasers, you can kind of use them similarly, they address different layers because problems in the skin live in different layers. So pigment issues are in the clear layer, meaning from 5 to about 300 microns deep. That's going to help with pigment, texture, tone, pore size. And then deeper in is where we do the real remodeling for patients with fine lines and wrinkles, and even to address her scar. So that's what we decided. We're going to do that next, and hopefully I'll be able to show you the final before and after.